We're going to go over another example of perforated acute appendicitis, and in this case we again have our axial here and then our coronal reformat. We're first going to try to find the terminal ilium. In this case it's a little tricky, but it looks like this is probably the terminal ilium that comes in and probably plugs into the cecum somewhere around here. So if we do our co-localizing, let's see if we can see that. It's probably coming in right here, and it's a little tricky because it's very decompressed, but our ileocecal valve is somewhere around here most likely. So okay, we know that this is our probable terminal ilium. As we scroll through, we want to look around this area, around the cecum, to see if an appendix is coming off. And it looks like down here more towards its base, it's very busy, but we seem to have something right here coming off, and then it looks like it loops around and points back from where it once came. And there's actually a little fecalithin here, a little bit of air. So this is actually a pretty good look for the appendix, but it's a very peculiar shape where it comes out and loops back around and kind of folds on itself. Now, there is a little bit of mild inflammation, maybe not the most impressive, but in the right clinical context, this definitely could be an appendicitis because it's a little bit dilated. It is air-filled though, but then once you actually kind of look a little bit more for our signs of complication, we see that there's actually evidence of perforation. So we'll just start at the top and kind of scroll through, and then here's all the air that's in the appendix. But if we go a little bit more, we'll see that, oh, there's that little concentric focus of air, which we'll investigate, but it's a little bit peculiar. It's outside this small bowel loop wall, and we'll just look and see nothing else. So now let's investigate this little area of air. And when we look here, we actually see that it's in communication with this very small amount of free fluid right here. But this is all extraluminal. It's not in these small bowel loops. There's that little bit of fluid right there which communicates with this little bit of air, which is extraluminal, and seems like it's probably adjacent to and associated with this appendix tip. So we have that free air, a little bit of free air, a little bit of free fluid. It's very subtle, but it is real. And that actually is enough for us to suggest perforation of the appendix. And there's the free fluid again, all outside the appendix wall. So a little bit of air and fluid right there. So in the long run, what ended up happening is this patient went to the OR, and this was free air and free fluid. It was a small little perforation, but this is a perforated appendicitis, and it can be just that subtle. So it's important, after you identify the appendix and you look for the characteristics of appendicitis, that you really look closely for free air, free fluid, especially anything that's adjacent to the appendix, to make the diagnosis.